In Nigeria today, there is a high prevalence of non-communicable diseases and other cardiovascular diseases, accounting for about 24% of total deaths recorded every year. Over the years, studies have linked the intake of excess sugar and sugar-sweetened beverages among leading factors of non-communicable diseases, also known as NCDs, in the country. In a bid to reduce the daunting effects of NCDs and other sugar-related diseases in the country, stakeholders in Nigeria's health sector this Wednesday stressed on the need for effective implementation and taxation on the sale and distribution of sugar-sweetened beverages in the country to a minimum of 20% in its final retail price. They made this known at a one-day national conference on sugar-sweetened beverage tax in Abuja, the nation's capital. Our correspondent was there and now tells us more. Sugar-sweetened beverages, also known as SSBs, can be defined as any liquid or powdery substance containing natural or added sweeteners. They are often found in soft drinks, juices, sweetened coffee, energy drinks, flavored dairy, among others. Over the years, studies have linked the intake of sugar-sweetened beverages to obesity, diabetes, heart diseases, kidney diseases and cancer, which currently account for 184,000 deaths recorded annually across the world. And unfortunately, Nigeria has been identified as the largest consumer of SSBs in Africa. Over the years, the federal government has been making concerted efforts aimed at addressing the worrying trend. In 2021, it announced the implementation of an excise tax of 10 naira per litre on SSBs in a bid to prevent and discourage excessive consumption as well as promote healthier alternatives. Despite these policies, only little progress have been made. Stakeholders in the public health sector believe this is so because monitoring and implementation mechanisms of the SSB tax policy in the country remain low and have therefore converged on this hall to brainstorm and map out a lasting solution to the issue. Speaking at the event, the Coordinating Minister of Health and Social Welfare, Dr. Mohammed Ali Pate, and Chairman Health Institution, House of Representatives, Amos Magaji, say the conference is timely, especially as Nigeria is grappling with a surge in non-communicable diseases and therefore expressed the federal government's commitment to ensuring full implementation of SSB tax in the country.
Taxation on SSB has shown effective reduction in its consumption in countries where it is enforced. The introduction and sustenance of SSB tax in Nigeria will reduce excess consumption of sugar-based beverages and thus reduce the burden of non-communicable diseases in Nigeria. The Federal Ministry of Health and Social Welfare is committed to attain the global best practices as recommended by the WHO. This commitment aligns with government efforts in improving the public health of Nigerian populace to meet up with the global priority of significantly reducing the premature deaths due to non-communicable diseases.
The 10th Assembly, as regarding health, is committed to any legislation that will promote the health, the well-being of Nigerians. And therefore, we are working with different stakeholders. We just had a retreat on the legislative agenda for the 10th Assembly last week, and then we are building on it, capturing different aspects of health, health insurance, health promotion, and anything that will promote the health of Nigerians and reduce the burden of health on families, on communities is what we are in for.
Speaking earlier, the Executive Director, Corporate Accountability and Public Participation Africa, Akimbode Oluwafemi, while lamenting the skyrocketing cost of managing non-communicable diseases in the country, stressed on the need to look for sustainable ways to manage the consumption of sugar-sweetened beverages in the country.
Every time governments around the world is trying to initiate public health policies, you do expect that industries will react. However, our governments are signatories to several protocols, several frameworks, several conventions that simply says when the issue of economics and public health is being discussed, public health takes paramount. And we are right here standing here today to say that the Nigerian government needs to stand with the public health of the people. There is therefore the need to immediately increase that tax. Government should be wary of the industry. The tax reform that should be done relating to excess-based tax, public health, is to have a sustainable policy law like other government that will ensure that SSB are taxed to that tipping point that will cause reduction in consumption and protect the health of our people.
The meeting, which featured stakeholders from various civil society organizations, non-governmental organizations, ministries, departments and agencies involved in Nigeria's health sector, also featured the presentation of papers, panel discussions and interactive sessions geared towards getting a sustainable tax regime and promoting public health in the country.